Hi, it's Jennifer Brewer. I'm the nurse specializing in wound ostomy and continence at the Collingwood Hospital, and today I'm talking about pressure injury staging. So, pressure injuries have 6 actual categories for staging, and I want to walk through what those are and discuss colors because that's how I actually like to describe them. There is a practice hint that we'll show at the end of the video so that you can have that kind of little bit of visual for it as well. So, stage 1 are pressure ulcers that are not actually ulcers yet. They are just non-blanchable erythema or redness. So it's when the skin is quite red, and when you do touch the skin, it doesn't turn white. It stays red. So those are ones that we really want to try. We know, there is a potential for this to break down very, very quickly. It can happen anywhere from only a couple hours, especially if they're on a stretcher versus on a larger, thicker surface. So again, it usually happens over an area of bony prominence. Those bones, especially if the skin is thinned in that area, that's why these can break down in a very, very short period of time. Again, they can be quite painful, they can be very firm, they can be soft, and they're usually quite warm to the touch. They may have some swelling associated with it, just localized, and they may, we do want to look at repositioning the patient more frequently, even every 30 minutes, just to check to see if that redness is gone when we first notice them. So again, I always call the stage 1s are pink ulcers. As much as, again, they're red, they're really, it's just pink skin that we're seeing to start. And then stage 2, these are the ulcers I call, are the red ones. So when the skin is now been removed, when you're seeing that top surface layer gone, what you've actually got is some dermal exposure, and you're seeing some red bumpy tissue, which is usually granulation. Those are your stage 2 ulcers. This is again another one that we can, if we catch it early, we're able to help manage these quite easily. And again, sometimes just a surface and or a dressing and some good turning and positioning is all that we need to get these to heal up. Again, this is a partial loss of thickness, and it is, again, the dermis that's exposed. It's usually just a very shallow crater. Sometimes there can be some swelling localized around it. And again, it's not considered a skin tear when they've had that very fragile skin that's come off. This is actually due to pressure, again, usually over an area of bony prominence. So these, again, are our red ulcers. So stage 3 ulcers, these are the ones I usually call the yellow ulcers because, again, this is usually now into the adipose tissue or the fatty layer of skin, and when you look into the ulcer, you can see yellow and or white tissue. But again, I call them the yellow ones because you're seeing much more yellow. Again, it usually is lumpy bumpy, which is indicating it is adipose. And again, it's considered a full thickness loss. So this, again, there is an extended amount of pressure, and it's developed down into the deeper tissues. Again, it is also usually over a bony prominence, and again can extend down, but not usually through the fascia. It can be deep and can be highly exudative. And again, the size of the crater can also depend on what bony prominence they were kind of sitting on. So the stage 3 again are our yellow ulcers. Stage 4, these are the ones that are usually white. So again, you're seeing muscle, tendon, bone. When you're seeing white structures, that's usually a much deeper ulcer and is down into the, past that fatty layer. And those are considered our stage 4. There's extensive tissue loss and destruction. Sometimes there's some necrosis. You can see some ischemia. Necrosis is usually the black, the ischemia is purple. And there can be sinuses, and we're often looking for tunnels and undermining. So again, that's the stage 4 ulcers. We're also, if we are seeing bone underlying structures, we can be concerned about sepsis and or osteomyelitis if we are seeing the bone, and those come with other treatments. So again, stage 4 is our white ulcers. Unstageable ulcers are usually obscured by some sort of tissue. Usually it's necrotic in nature, which is why I tend to call these the black ulcers, because often there's something called eschar, or a black scab that's developed over top. This is due to ischemic changes as well as necrosis. Necrosis is the key that needs to be removed before we can actually see how deep the ulcer is, which is why that becomes unstageable. Again, there can be areas where there's necrosis and then slough or devitalized tissue, so sometimes it can be mixed, but that still does make it unstageable until we can see underneath that full necrotic area to see if there's any underlying structures. Again, so the unstageable ones are called our black ulcers. And then last but not least are a suspected, or they're now just called a deep tissue injury. These are usually injuries that happen from a traumatic event and or for prolonged periods of time sitting in one area, and we get a very deep bruising to the area. Sometimes these can actually develop into hematomas, and quite often these ulcers do develop further down into a stage 3 or stage 4 ulcer because the trauma comes from the inside, not just the outside like a regular pressure injury does. So these are considered our purple ulcers. When you're seeing a really deep purple, maroon color, those are deep tissue injuries, and we have to be very mindful of them. Now, for staging, again, there is a new pressure injury protocol coming out that I would hope you can review. It does go through what bed services we're putting patients on based on their Braden scale and the stage of their pressure injury. Also, what dressings that we can use for prevention, and depending on, again, your Braden scale, and then if we need to get them an additional surface for underneath them. Deep tissue injuries, again, are probably the worst of the kind. I still want to review a few other pictures just so you can see some of the differences, and we'll talk about it via colors. So this here is a suspected deep tissue injury. This was from a Zimmer splint that was left on, and the patient was not moving out in the bed very often, and the Zimmer splint was to be taken off to allow it to relax. Unfortunately, the patient had gone to rehab and still had kept the Zimmer splint on, and after a period of time, it developed down into a very deep stage 4 pressure injury. So again, when there's recommendations to stop certain devices because of the suspected or this deep tissue injury, we want to ensure that we stop using them, because pressure ulcers are either from an external pressure, either a device related or something internal from the patient laying or sitting for long periods of time and due to trauma. So again, this is a pressure ulcer that occurred from someone who is wearing a prosthesis. These occur sometimes because the prosthetic itself is not well balanced, or the patient's had it for a long period of time, and or it's brand new. We do like to usually wait for the surgical site to be closed for approximately 6 months before they're put into a prosthesis, anywhere from 3 to 6 months. However, these do happen once they start walking, or they've been walking for a period of time much longer than what they normally have, so then they do develop these. Now this one has 2 colors in it. You're going to see that it has a lot of yellow, and it also has a lot of red and pink. So this would actually be a stage 3 because the majority of it, not just the majority, but because the deepest part is actually showing that it's down into the adipose tissue. So we would stage that at a stage 3. This pressure injury has a lot of red and only a little bit of the yellow. But again, we also never reverse stage. So if this ulcer was a stage 3, it always is called a stage 3 ulcer. Because again, when you go back, if it actually gets re-injured or whatnot, you want to know that there was something of that depth and how much scar tissue was actually developed. So what layer it actually had to go down to for the wound to actually heal. So this again would also be a stage 3 due to the amount of yellow that's in the wound. Now, this wound is lovely red. If someone on the first glance of it would look at it and say this was a stage 2 pressure injury, and you wouldn't be wrong in saying that. But again, if this was something that was much deeper prior, it may have been a stage 4 ulcer. We don't actually, again, reverse stage and now say it's a stage 2. It doesn't go backwards. It still was a stage 4 ulcer, but it's healing. So this itself, again, we've got only, the majority of it is red on the ulcer. So this, again, would be a stage 2. Now this heel, again, it has that pink non-blanchable erythema. So this is what will be considered a stage 1 ulcer. Now, hesitate for the bit of blurry. This is also an area of stage 1 because it's only pink. All the skin is intact. But we do then want to be cognizant of why this happened, and is this from their wheelchair or the jerry chair they're sitting in. So that's then going to tell us, as much as yes, we know it's a stage 1 ulcer, we also have to look at what device is potentially causing that pressure injury. Here's another suspected deep tissue injury or deep tissue injury because of the purple discoloration in the middle. It often does have this rim of erythema around it because it becomes inflammatory because of the injury. But again, we want to try to offload this patient as soon as possible so it doesn't deteriorate further. So thank you. This is my presentation on pressure injury staging, and we will go through the pressure injury prevention tool once it's available. Thank you.